The screening recommendations also changed, which I would like to share with everyone. So if you have implants, with or without breast, so even if it's just after mastectomy or as an augmentation, you should get either an ultrasound or an MRI 5 to 6 years after the implant was first placed, and then every 2 to 3 years thereafter, specifically to assess the integrity of the implant. Make sure it's not ruptured or leaking. I have to say, if you have a saline implant, you'll know if that's ruptured because
yes, you will. That's what we call a flat tire. You will notice that. Right. Right away. And, you touched on it briefly. And finally, that group of women, we talk about breast implant associated illness. Well, right now it's not looked at as a defined, definite illness per se, but, we're removing more and more implants. And interesting enough, a lot of these women feel better. We don't have all the information yet, but just being aware of it and their voices were heard, we do need more study to see, in fact, if there is a subgroup of women who just don't tolerate breast implants that well. And you already alluded to it, that it was identified there is a particular type of cancer. It's not a breast cancer. Actually, it's a lymphoma. It's called breast implant-associated anaplastic large cell lymphoma. It's related to implants that have a textured surface. The body reacts to that textured surface in a way that creates an inflammatory reaction. It's that inflammatory reaction that may progress to a lymphoma. So that's just one of the other reasons why the black box appeared.
Exactly. I think it's important to reiterate. So whether saline or silicone, smooth or textured, implants of any sort have never, ever been known to create or promote an actual breast cancer. So the lymphoma that Dr. Orton's talking about, thankfully, is pretty easy to notice. So you should, if you have particularly textured implants, but if you have implants, once a month, make a dedicated stare at your breast in the mirror and ask yourself, is one breast suddenly bigger than the other? Is there some redness? Is there a lump? Feel around. If there's anything new, bring that to your doctor's attention. The good news about the breast implant associated lymphoma is that when caught early, all you have to do is take out the implant and the capsule and you're cured. A very, very small subset of these lymphoma patients require chemotherapy or radiation, and a very tiny number of women have actually died from it. But for the vast majority, you just need the implant removed.
Great information. As always, Dr. Funk, you are on top of it. Thanks for coming today.
Thanks for asking me.